and congratulate Bill for the work he's doing, and congratulate you for the effort you put in this kind of work. The other thing I wanted to mention is, like most of you here, I'm an immigrant, and it's so nice and so touching to see 3 generations getting together and holding hands and thinking about the future of this community. This is really, really touching. Nephrologist means a kidney specialist. And a kidney specialist is somebody who basically deals with a variety of conditions affecting the kidneys. But one thing I wanted to tell you is it's a very difficult task for a physician nowadays to deal with prescriptions. Okay? You all know how busy we all are, doing different things. Physicians are busy too, and one thing I realized after many years of practicing medicine and nephrology is, I don't know, maybe it has to do with the fast lifestyle you live. People are much more likely to ask for a prescription to get a fix of their condition rather than, let's say, change their lifestyle. And I'll just give you an example. I had a patient recently, and it just happens I'm very interested in the effects of lifestyle on kidney disease in general and on health in general. So this patient has a number of medical conditions, including diabetes, high blood pressure. He's a little overweight. So during the visit I spent, I don't know, let's say 10-15 minutes talking about lifestyle and saying that, you know what, I'm actually running an exercise program and I see the benefits of exercise and diet and so on, and this might have significant implications on the quality of life and the way the person feels. And this gentleman looks at me and says, okay, are you done? I said, yeah, I'm done. Okay, can you give me a prescription to fix all these things? I don't have time for all these things. I don't have time for exercise. I don't have time for this thing. It's interesting that people were so busy. There's 24 hours a day we spend, but we spend so many hours doing, I don't know, job-related things, business and so on, but we allocate so little time for ourselves. And that little time for ourselves is hugely important, okay? And can have significant implications in terms of how we live, how we evolve, how we educate our children, our peers, and so on. So it's very, very, very important. So in terms of prescriptions, as you probably know, there's legal and illegal drugs. A lot of drugs, which are prescription drugs, are prescribed by physicians. And usually people think about those drugs as safe. Why safe? Because they are prescribed by a physician, okay? The issue is most people who abuse prescription drugs do not use those drugs in the way they are prescribed by a physician, because those drugs are usually prescribed for a certain reason. Let's say, just give you an example, for some pain, which could be either acute or chronic. And usually we tend, and most of the time I think we're successful, in terms of relieving the distress, relieving the pain. But those drugs, although considered safe, have a very significant effect on people's physical and mental condition, and a lot of them are very addictive. To a point that, like probably most physicians, if there's any physicians here, most physicians who practice today in Calgary, we have our patients, we know after a certain period of time they're going to come back asking for that same drug. Okay? And it's very difficult to change this behavior. Sometimes we end up sending them, referring them to a pain clinic or to a specialist, because I'm a kidney specialist, so I don't have training in, relieving pain or treating insomnia or anxiety. Having said that, we all end up prescribing some of these drugs once in a while because for different reasons People don't have access to a family doctor. Sometimes it's very time-consuming, and as you probably know, there's pain clinics in town, but the waiting list is 3 to 6 months. So the question is going to be, what are you going to do the next 3 to 6 days when somebody has significant discomfort? So it's not very easy. The other issue with prescription drugs is they're very easy to get. Okay, so it's going to be probably hard for me to get some illegal drug within the next 24 hours if I decide to experiment on one. Whereas if I go to a walk-in clinic and I check myself in and say I had some major trauma as a result of getting into a fight with my sons, or I'm passing a kidney stone and I'm in terrible pain, the likelihood of getting a prescription drug, a painkiller, is probably fairly high. The other thing is, as you probably know, prescription drugs can be found in the house. So, in our house, for example, we have medications, and we usually keep them away because my sons are 10 and 8, and we don't tend to leave medications in areas where they are easily accessible. But not everybody does that, and sometimes these prescription drugs, let's say painkillers or anti-anxiety drugs or sleeping pills, are left somewhere by the bed or in the kitchen and so on, and it's so easy to have access to them. And there's something called curiosity, which is, something usually very good because that's how we learn about things, but that curiosity sometimes can be dangerous, and children, teenagers, adults hear about an effect of a certain drug and say, you know what, I'm kind of down, or I'm like in a lot of pain today, or I have problems sleeping because of the test which is coming, or whatever it is, or I'm very anxious, I'm just going to try this. And there's this sort of temporary relief of symptoms, which is very, very tricky, and this is probably the beginning of addiction, when people get that sense of, you know what, this makes me feel good. I'm not so worried about the exam the next day. I'm not so worried about my performance in school or in other setting, and slowly, slowly this evolves. So it's a major problem. The other thing I wanted to touch on, because as you know, by the time somebody is hooked on drugs, it's late. A lot of changes are very significant, sometimes are irreversible, sometimes the productivity of a human being who is abusing drugs is compromised. Children, teenagers, adults don't complete school, they cannot get a good job, so there's significant implications. And one thing we sometimes think about is risk factors. So when you think about the risk factor for somebody to become a drug user or a dependent, they are right there in front of you, and if you identify them, you can prevent these things from happening. So in terms of risk factors, I would, like, being a nephrologist and a physician, I usually stick to schemes and so on, and I'm trying to get words which are easy to memorize. So for risk factors, I would try to get you to remember the letter F. Okay, so F. So friends are risk factors sometimes, and some people think that this is probably the most important thing, because sometimes there's peer pressure to use drugs. Okay, so I have a colleague at work who basically is desperate. She's a very busy internist, and she's desperate because her son got into, drug use habit, and it's very difficult for her to break this because the son's friends use drugs. So when they get together, this is the main activity they do. They go to parties and they do alcohol and drugs. Okay? So it's very difficult to intervene when there's this sort of peer pressure. That's why if you want, if one wants to prevent this, the main thing is to create a culture where young people, so children and teenagers, have to say no to that kind of behavior. Discourage smoking, discourage experimenting with alcohol and experimenting with drugs. There's so many other things youngsters can do and still feel good about themselves and about their friends. So that's the first F. The other one is family management issues. Okay, so a lot of people who try drugs, experiment with drugs, have a lot of stress in their families, and sometimes they have this issue, and I hear it over and over again. Don't get me wrong, I'm not a pediatric nephrologist, but I end up talking to a lot of young people, and especially when they hit the teenage years, there's this sort of, mom and dad are too busy, mom and dad are never here, mom and dad don't know what's going on, they don't understand me, so I'm an adult, I'm on my own, I'm able to make my decisions, and sometimes these decisions are wrong. And if the family is dysfunctional, and there's no communication between brothers and sisters, or especially parents and children, it's a disaster, especially if there's drug abuse. I'm not going to think about hard drugs, but especially if there's smoking and drinking alcohol in the family. Okay, it's going to be very difficult for mom and dad, if they smoke and drink, to go to the kid or a teenager and say, don't do this, don't do that, and so on, because they basically do it. Okay, so it's a tough situation. The other F I wanted to mention is the word failure, and this failure is, if I think about somebody who is a teenager, would manifest in two areas. One of them would be school, okay? So, a young person who is failing in school, there is research showing that they are more likely to do drugs, okay? They're not happy, they're anxious, there's all kinds of things happening, and then sometimes they find relief in this because they have all kinds of guilty, like there's guilty complex, there's blame, there's insecurity, which develops as a result of that, and sometimes this, like, different kind of drugs, including illegal and legal drugs, give the person this kind of sense of security, which is very short-lived, temporary, and misleading. The other thing, which I think is very important, is failure in terms of healthy, recreational, and leisure activities. Okay? I'm an immigrant, I interact with a lot of immigrants, we all know how busy life is when you come to Canada and you want to get the bull by the horn and establish yourself, you get a job, sometimes 2, sometimes 3 jobs, and you work from like 5 o'clock in the morning to 12 o'clock at night, and so it's very difficult to get this sort of like, okay, what do we do as a family? But sometimes, and research shows that if there's a failure of this sort of like recreational and leisure activities, and this includes exercise, or yoga, or going to the community center, or going to the church or the temple. If there's a lack of this, those kids, those young people are much more likely to get into those kinds of habits. So of course, this failure can, if you look at the other side of the coin, can be reversed and can be used as a preventive strategy. Okay. So the second part of my talk, I wanted to, I don't know, give you a point of view of a nephrologist to what is going on with our health in general. So a kidney specialist, I'll just give you an example of, let's say, a usual day when I see new consults. People are usually referred to me for some sort of kidney condition, but the kidneys actually are a bunch of blood vessels, okay? We were able to study the kidneys fairly well because from the kidneys we get the urine, which allowed us over the years to understand better what's going on. But at the end of the day, the kidneys are a bunch of blood vessels, so when we deal with the kidneys, very often we deal with the blood vessels or the vascular system in general. So I'm going to ask you a question, okay? What do you think the most common cause of kidney disease in Calgary is on March 19, 2016? Very good. So high blood pressure. Very good. It's one of the most common, and there's another one, diabetes. Okay? So I just want to tell you that probably 2/3 of our patients are seen by us on a regular basis and become our regular customers because of those two conditions. And just to give you an idea, that if we do something to prevent diabetes and hypertension, people like me are going to be out of business within the next 20 to 30 years. And I'll tell you, I wish I would be out of business in 20 or 30 years. Okay? Because it's very important what we do with prevention, and the next speaker is going to give you an idea about the work done right now. So, the other thing which is interesting is we see patients who have kidney disease, but the kidney disease is a window to what's happening with the body in general, and a lot of the morbidity, a lot of the conditions people like our patients develop have nothing to do with their kidneys. So a lot of our patients die because of heart attacks or strokes. And the kidney disease is just a marker of the fact that their vascular system is failing. And one thing I wanted to bring up to you, and it's interesting that the most important epidemic we're dealing with right now in the world, and probably North America, is the epidemic of diabetes. And a lot of it has to do with the fact that 30%, 1/3 of the youth in this country is overweight or obese. Okay? So you can imagine the implications of this. Why is this important? It's important because we can address this early, and we can intervene early and hopefully decrease the chances of this big tsunami, which is basically hitting, it's basically hitting Vancouver in brackets, and it's going to swipe over Canada. It's moving that way. So, prevention is very important for kidney disease. And if somebody asks me, okay, what are the medications you're going to use by the way of prescriptions? It's very easy. And what nephrologists do and wish the patients would do is exactly what a cardiologist does and wishes their patients do, or a neurologist who deals with stroke does, and endocrinologists who deal with diabetes. So it's basically good common sense, paying attention to those 10,000 steps we're supposed to do in a day, try to move to get moving, try to drink the water we need to drink to flush the kidneys, because drinking water is very healthy, try to stay away from salt, and try to maintain a healthy body mass index. Body mass index, as you know, is how heavy we are as compared to our height. So if all these things are done, and there's a lot of research showing that a very significant impact in communities is happening when all these things are addressed. Okay? So, one thing I wanted to mention, as my time is up, I think, right? Is I'm very happy to have friends in this community, and I see a lot of good things happening. I would like to be a speaker again, and I would like to give you some information about what we see happening at our level, which is going to be a sign of healthy lifestyle in the community. Thank you very much.